problem. First is that we wanted to be careful and thoughtful in our 4-step plan. We know that after being in a not a lockdown, but in a restricted manner that we've lived in for 15 months, and Dr. Henry and Mr. Dix for 18 months, that it's going to take us a little bit of time to build the confidence from the public that things are, again, safe to do so. But also, it's going to be important for us to do it gradually so that we can continue to monitor every stage how things are moving, so that we can ensure that the pandemic is being managed all the way through. And of course, the biggest piece for us has been the vaccines. And I believe yesterday we were at just under 66% of the population that had the first dose, and I believe it was around 62% of everybody above the age of 12. Over 50% of 12 to 17-year-olds were registered for a vaccination within the first week of us opening it up, which is a really promising sign that people are taking it up and taking this serious. So we'll go to the next slide. I think I don't need to give you too much on where we've been. I think all of you have lived it and gone through it. But I do want to just highlight that the circuit breaker obviously came in when we saw a surge in cases in March, and it was fairly sudden. But the benefit that we've had here in British Columbia is that we've let our health professionals lead the decision making and given space to Dr. Henry and her team to move when they felt that it needed to be moved. And we saw the test positivity rate increase over a 4-day period, and alarms went off at provincial health at the office, and we had to bring in the circuit breaker in a very quick manner to curb off what could have been much, much worse. So after that circuit breaker was obviously done, at this point on May 24th, we had over 60% of people over 18 have been vaccinated. And as of now, I believe the number is close to 66%. That's my last update. So we'll go to the next slide. This slide, I just wanted to highlight that the vaccines work. If you look at this slide, and just some people joke it looks like a cat, but this slide, you'll notice that since the increase in vaccinations, there's been a dramatic drop in cases, in hospitalization, in death, and it can be attributed directly to the vaccination campaign. Similarly, if you look at graphs from Prince Rupert, which had a significant outbreak where the community was vaccinated, you'll see that they had the similar trend lines as this, but much earlier than the graph shows for everyone else. And I believe yesterday they had 0 cases, and the day before they had 0 cases. So, and that's with, I believe, close to 70% of people being vaccinated. So very promising. But it's important to highlight to folks that vaccines work, and this slide shows an example of how effective it can be. Next slide. So the 4 foundations for our restart. Obviously, getting people vaccinated. It's the case counts continue to be declining. Our hospitalization and ICU numbers are becoming more manageable, and we're seeing decreasing in numbers. And the biggest thing for us in the feeling comfortable that we can move forward is that we have a steady vaccine supply. And so we feel confident. Dr. Henry has shared publicly that we believe we'll have enough doses to have everyone that wants a second dose to be done by the summer. And of course, I believe it was yesterday, we opened up the second dose for people who work in the healthcare system that haven't gotten their second dose, some people who are on the vulnerable list, and people over 70 and are starting to be contacted for their second dose. So that's a positive sign. So we'll go next slide. So this is the big piece that you obviously see floating around on social media. And the big piece, I know that Gary, we've had conversations about, certainly BC Chamber and many of our other stakeholders, was a call to have some metrics on how decision making would be made as we move forward, and just getting a sense of how we at the province and the Provincial Health Office is going to assess going between stages. And we actually went a step further and put some projected dates in there. A couple things to highlight are obviously the C is for cases, H is for hospitalization, and the dose one, the D1, is the percentage we hope to get at. The dates are 3 weeks apart. That gives 3 weeks for those that have been vaccinated for their vaccine to take full effect. But at the same time, that's the window that we need to ensure that that the vaccine has been effect, or the changes we've made continue to see the trend lines in the cases, in the hospitalizations that we want to see. So it's the incubation period that PHO would like to continue to monitor. So far, so good. You'll note that the June 15th timeline for step 2, it says dose 1, 65%, and we believe that we are, actually not we believe, we are past that 65% as of today. And the last thing I'll say, because I'm going to go into more details on the other slides, but the percentages are not what we are going to stop at. I just wanted to say that because some people did ask. These are minimums. Obviously, our goal is to vaccinate everybody and anybody that is able to get vaccinated. And so our hope is to be much, much higher than that. But those are minimums that Provincial Health Office feels we need to meet in order to get to the next step. We'll go into more details on these slides. Maybe we'll just jump to the next slide. As I've highlighted, the 4 trend lines that we're monitoring, and I won't go into too much more detail on that. It's just, it's been highlighted on the main slide of our metrics, or the PHO guidance metrics that we're going to be using. Next slide. And in these, some things that are going to remain, and we want to really highlight this and emphasize this to folks, is obviously get vaccinated. Encourage anyone you know and everyone you know to get vaccinated. The sooner we do, the sooner we can continue to move between the stages of opening up and have some sort of normal back in our lives. The mask guidelines are still in place, although they will evolve certainly as we get past July. And I think the biggest changes you'll see will be in the fall, where our hope is we move to a place where the masks won't be mandatory and they will be optional for those who want to wear them. Of course, stay home and if you're sick. I think that goes without saying. And I'll go into a few other slides on the Worksafe guidelines that will be in place. Next slide, Karen. So, we put these couple slides together because people always want to know what this means for them. And so we wanted to be able to highlight what this means for people in their homes. As of today, well, as of Monday or Tuesday, outdoor personal gatherings of up to 10 people can happen. That's outdoor barbecues. That doesn't mean 10 people go outside and they come inside. That's meeting 10 people in your backyard, for example, and up to 5 visitors or a household can be indoors at one time. Now, there's some flexibility in this. If you have 5 visitors one day, it doesn't mean you can only have the same 5 visitors. You can have a different 5 visitors next day if you would like. But we're urging people to be very gradual in this, but we understand the need for people to see loved ones that they haven't seen for a long time, and we wanted to create some space in this because with all these measures we put in, there's a real mental health impact in our society that we are very aware of and want to make sure that that we are allowing for some of that social interaction to happen again. In step 2, it increases to up to 50 people outside, but we're keeping the indoor personal gatherings at the same, and then it'll evolve as we go forward. So the next slide. Organized gatherings are slightly different. So we've had some questions about what does it mean to have, what is a personal gathering and organized gathering. Organized gathering can be a wedding where everybody is seated, no wandering around or mingling, and you need to have a safety plan in place. We've had some folks who wanted to do different types of weddings, parties associated with weddings, because they thought they could maybe in step 2 have 50 people for a big party, or a more than 10 people for a party. And so we'll have more guidelines for those that are wanting to do an event. But at this point, it's with a seated safety plan. So it's not, you can just get a bunch of people together and have a party for 50 people. And I just wanted to emphasize that because that's an important piece that we want to make sure people are aware of. And of course, it increases as we go. And you'll note that fairs and festivals as of July 1st are able to happen with a safety plan. And some major festivals are already engaged with us on how to make that happen. Next slide. Travel, this is the biggest question I get is around travel, and people are just itching to get out. So right now we have the 3 zones, and people are able to and actually encouraged to travel within their zones, get to see your own backyard and enjoy your own backyard. So that means those on the island can go to Salt Spring Island, etc. It means people in Metro Vancouver can go to Harrison for the weekend. And of course, people in Prince George can go as far as Cranbrook if they like, or into the interior. But we want people for the next 3 weeks to stay in their zones, considering that we have still relatively high cases in Metro Vancouver in particular. As we get to stage 2, of course, we're opening it up, and we will be encouraging people to travel and get away with their families. And then July 1st is when we will start welcoming people from other jurisdictions. Of course, they can travel right now, but all the provinces are urging people, if it's not business related, not to. If it's not essential, not to. But that is the next step. And the questions around international travel come up. There are conversations happening between the health officers across the country, as well as the premiers with the Prime Minister, about what measures need to be in place to allow that travel, and what measures will be required for people to travel. And I don't have the answer on what it will be, but certainly those conversations are happening at the national level. Next slide. This was a big deal for a lot of people who especially have little ones who desperately need to get out and play games, whether it's baseball, hockey, soccer, or whatever it is. And so the ability for local games to start happening, it was a big step. I talked to the Little League folks who've already got games scheduled happening this weekend. So they moved really quick to get that up and running. And yoga studios, of course, and then it'll increase as we move, as we go forward. And the Premier has certainly indicated that our hope is that we'll be able to, in the fall, see hockey games and see Whitecaps games, and maybe even rugby's 7th this year. So all those associations are working closely with us on plans to try to make that happen, make that a reality. So next slide. Of course, for the business community and those with restaurants, they already know that this goes back to pre-circuit breaker rules. Liquor served till 10 p.m. In step 2, the liquor service goes to an increased time of up to midnight, and we're in discussions with banquet halls right now. We had a meeting yesterday about what that means and how they can operate in a safe manner to have events for more people. And so there's discussions on what that capacity limit may look like, what protocols they need to put in place. We've started that conversation, and so we'll have to see how that goes. But they will be able to have minimums automatically, but there's some questions around having an event where a hall is split in two, but they have complete two separate entrances. What does that mean? So we're going through all those things with them in detail with provincial health to see where we can find a solution. And of course, in July, we're expecting a lot more to open up: bingo halls, casinos, and even nightclubs with some sort of limited capacity. Obviously, all with safety plans, and those conversations are ongoing. And of course, at that point, we project that we'll be able to lift limits on indoor dining, so restaurants will be able to go back to a normal capacity. And my hope is that the outdoor setups that they have continue to remain. I don't know why they wouldn't, but of course, local governments will have their say. And we'll go on to the next stage. Great. This was an important piece for those who were looking for guidance on what it means for workplaces. And we have lifted the order for people to work from home. And we're urging businesses to find a gradual way for employees to come back so that they feel safe, they feel comfortable in their return. We know most employers had existing safety plans, and so those safety plans will kick in. And then we expect by June 15th to be able to have small in-person meetings. Well, there'll be more guidance made public on what that might look like and how you can do that in a safe way. And of course, the question we get about seminars, and especially chambers wanting to have in-person networking events, and more of that will happen over time. Smaller seminars and I guess gatherings of meetings probably will happen over July, and we expect in the fall for that to open up to large events. As it notes here, even some holiday office parties that have been put off for the last 15 months. I think everyone is craving to see their coworkers and friends again, and certainly that's our hope. Next slide. And so we have an industry engagement table, which is 75 organizations or associations. The BC Chamber is represented there, and we have started some conversations with various sectors on issues and challenges they may see as we go between phases. And we have an ADM that's now dedicated to work with sectors to help facilitate conversations between provincial health office so that we can get good safety protocols in place and answer questions that we have answers to, and then have more detailed responses worked out with provincial health office as we need. Of course, Worksafe is going to continue to evolve in their protocols as well, and so we're engaged with all of them and the stakeholders to figure out and try to troubleshoot challenges as we see them. And certainly, Gary, if you start hearing feedback about questions, feel free to share them, and we'll try to get answers for your members. We'll go to the next slide. I believe there's one more. And this is just an update on Worksafe plan. So step 1 and 2, it's a high level. A lot of the phases and the plans that were already built are already in effect. I think the bigger changes will happen in step 3 and 4. And so that's the time and the window we have now to adjust the Worksafe plans accordingly. Okay, and I think that might be the last one, Karen. I think is there one more? Okay, I won't spend too much time on it other than say that a big thank you to everyone on this call and all our stakeholders across the province. It's been something, and if we can make it through this, we can make it through anything. Is what I say, and so we appreciate all your advice and thoughtful questions, and obviously we'll need to continue to work together as we move forward. So that is the slides that I had, Gary, and I'm happy to take any questions you may have.
Well, Ravi, thank you so much. It's just such a relief to have a map, have a plan that we can all look forward to with some hard dates as to when these transitions are going to occur. It's certainly taken a load off my mind with regards to what the future is going to look like for us. keeping in mind that we have to continue to be diligent with all the safety measures that we've had, and again, to proceed with the vaccination rates that you referred to. So I have a couple of questions, and these are personally related. So in your presentation talking about, I think it was July 1st, we'll be able to entertain family members and friends from other provinces. So I was talking to Mom last night. Mom's back in Ontario, and her 85th birthday is coming up in August, and 86th is coming up in August. And we would like to get her out here for her birthday. Now, Ontario's been lagging a little bit behind with regards to the other provinces and being very cautious with their restart. Is there any concerns or any issues for interprovincial cooperation and travel where, you know, one province may not be at the same level as we are in British Columbia?
Yeah, that's a great question. You know, I think that the province that we all I stress about is Manitoba right now.
Mm,
You know, I think there's an understanding that, you know, we want every province to start seeing declining numbers. It's, you know, we compete as provinces in everything, you
yes.
know, hockey teams to
Yeah.
economy to everything. But in this, there's no competition. You know, and so I worry a little bit around Manitoba, but certainly we're starting to see declining cases and an increase of vaccination in Ontario, Quebec, in fact, all the provinces. And so we do think that in the next 3 weeks in particular will be telling sign for what's happening in Ontario and Quebec and BC and in Manitoba. I think in 3 weeks it'll be a little more clear. But you know, from our conversations, uh, we project that by that time, by July, it won't be an issue. And so I certainly hope that you get a chance to see your mom, Gary. I know since I became minister, which feels like a billion years ago, I haven't seen my mom since then. And so I look forward to it. She lives in Victoria.
Right.
So I look forward to being able to see them. And I know many others look forward to that.
Yeah. Thanks, Robbie. My second question is around our chamber golf tournament, which is scheduled for the 24th of June, which is after the June 15th transition for number of people to be able to gather outside, up to 50 people. So we've been working on the premise of tea times only, and, you know, obviously people staying within their own bubbles with regards to foursomes and twosomes. And the golf course has told us we don't want any other individuals on the golf course. But with this new health order and relaxation, does that mean that we're going to have a little bit more flexibility as far as having, say, a sponsor tent up at a tee box with product or things that they want to promote at the golf tournament?
I suspect so. I mean, I know a golf association, I suspect they're already engaged through Via Sport on what the guidelines would change between each stage for them. And I wouldn't be surprised if there's more flexibility, certainly on the outside, outside the clubhouse, so to speak, on who can be there and how they can set it up. I think it's a question worth posing to the Golf Association. If they don't have an answer yet, then we can certainly help them get that answer. You know, a golf tournament can happen right now. It's just what happens
Yeah.
at the clubhouse is what we worry about. And after a long day and someone has one social drink and people start forgetting that, that we have a pandemic. And so we haven't seen cases from people playing golf or being outdoors, really. It's been mostly from the activities after. And
Right.
of course, if you choose to have an event indoors, up to 50 people where it's seated and food is coming to you, of course, in stage 2, you know, you'll be able to do that. And of course, I know that hopefully the weather is great and you can have the event outside and it won't be an issue.
Great, thanks. I'll go to some questions that we've gotten from the chat here. What can the province do to convince the federal government to update border controls? Air Canada, WestJet have asked the federal government to amend the border controls and restrictions, but the health minister seems to be resisting. We need those border controls updated to support the tourism recovery.
Yeah, well, there is a lot of conversation happening on that, and I think the challenge for the federal government is every province is in a different place, and they're trying to manage everyone at the same time, and they're all their expectations. We don't have an answer for sure, but I do think that there's going to be some sort of vaccine passport model that's set up, where people who are vaccinated are able to come. Europe has already moved in that direction. The US has signaled that that's something that they're interested in for their own safety, and so, but I don't have anything definitive. Of course, that's all the federal government's decision making. We have made it clear to them that when it's safe to do so, we would like to have things open up, but not until we feel it's safe to do so. And in the way we've got it framed here, we don't want people from across Canada traveling here till July 1st, let alone the US. And
right.
We've already passed Washington State for first dose vaccinations.
Wow.
And I think they're at 63%, and we're obviously close to 66. And Washington State is one of the better ones. And so, it worries me a little bit about where they are, considering how much vaccine they have available. And so, so I can't give you an answer on that, other than we've engaged with them at a high level to try to find out where they're at and how their decisions are going to be made. But they're managing, as I said, any decision that happens will affect Manitoba, will affect Quebec and Ontario and all the other provinces that are still going through a bit of a challenging time. And so they're going to be cautious, and I'm not going to guess what it might be today.
Okay, thank you. Question with regards to having the workplaces open up and people coming back to work. Daycare needs will increase. And are there discussions? I know this is on the budget platform that came out with regards to more daycare spaces. Are there discussions happening with daycare providers in any directions, recommendations on the process?
There's lots of conversations happening. The Minister of Childcare is engaged with PHO, and I don't have details on how many more children or what safety protocols will look like, although they have protocols that are not going to change till at least phase 2. But there are conversations going on right now, both at additional dollars for increased capacity and more childcare spaces being created. Obviously, the federal government with their budget has indicated that they're wanting to get in the game, which is positive. But the Ministry for Childcare is working closely with PHO right now on those guidelines, and I'm sure they'll have more to say closer to when we get to the next stage.
Okay. So, Ravi, one of the issues that a number of our small business owners and businesses generally, as far as the management encouraging employees to get vaccinated, that if there's some concern, from the employee to get a vaccination, or if they get a vaccination and they become ill as a result of the vaccination and have to take time off work, what are the liability issues around that for the employer?
Yeah, there's lots of conversations happening at the BC Chamber and the BC Business Council and all the other associations around that, and some have asked, how can we ensure that our workers have vaccinations? Can we have only people who've been vaccinated come into our business? And this is a national debate that's happening. Certainly, the province has gone to court with nurses around flu shots in the past and lost the court case. And so, the province is not about to weigh in, but the business community may want to consider their options. And I know that there's some discussions happening amongst the legal community about what the rights are and what can be done. I think, the connection between people coming in and them having a vaccine passport is a lot easier because we already have a framework for that. Many countries, when you go, you must show proof of vaccination. So there's already a template and a model for that kind of thing. But beyond that, within our borders, there isn't. So it's going to be a bit of a challenge.
Okay. Next question I have is
I saw Rick's question about the Canucks games. I look forward to going to the Canucks game with him, wherever he is on the screen. So we've been in conversations with the Whitecaps, the Lions, the Canucks, and Rugby Sevens about how we can safely have those sporting events happen. They're going quite well, I have to say. But the Lions and the Lions have the Blue Bombers and what's happening in Winnipeg. So there's a lot of components to the teams that are the associations are national based. That perhaps the Rugby Sevens don't have the same challenge. We could easily fill the BC place up with rugby fans just from BC without the international tourists. And so that one's a little bit easier to have a conversation on, but the other one's a little more challenging, but it's been going pretty well. And again, I think all of us are hoping that we have those games back. And as a Whitecaps season ticket holder, I don't even care if they win this year.
Yeah.
I just want them to go to a game again. So they got 1 year with where they're off on whether they win or lose.
I think I heard in the news this morning that in Quebec, Montreal specifically, because of the playoffs, they're allowing limited spectators into Air Canada Place for the playoffs, which is very encouraging.
Yeah, I saw that as well.
Yeah, good. Next question: Could you speak to resources which might be available to small businesses that have no large industry associations to find support for making changes regarding removing some of the extensive practices which have been put into place? For example, the retail guidelines cover everything from mom and pop stores to a Costco Save On Foods. How does the small retailer, where do they go to get support and advice?
Yeah, I appreciate that. The Delta Chamber is a good place. And so, I think that if some of them want to raise specific, unique issues that they have that other associations can't handle, Gary, I'm happy to try to get answers for you. So that would be, I think, the best place to do that. I know that the Retail Association of Canada has been engaged on kind of the bigger retailers, but I appreciate that. Them not having arrows on the ground doesn't really help a small retailer.
Right.
And so, we will, if there's some unique circumstances or issues that your members come up with, please raise them with us and we'll try the best we can to get you an answer as quick as possible.
Fabulous, thank you. Another question with regards to people that have had COVID, and their immunity, their level of immunity, that someone who receives the vaccination, do they need to be vaccinated to travel? And if so, why?
Yeah, I wish I had Dr. Henry beside me to answer that question. It's very much a provincial health office question, but I'll say that my understanding is, I believe that it's 3 months from if you've got COVID to when you can get vaccinated. That's what I think that's what the number is.
Okay.
And so it's not that you've got COVID and you're free. You can get vaccinated. You should get vaccinated when it's safe to do so. Again, that guideline comes from the national body of provincial health officers who will give us what they find is the best guidance and research that's happening in the world. And the research changing all the time, and they're always trying to update on whatever they're seeing from other jurisdictions. And Israel and UK are ahead, and so we're watching a lot of their examples and seeing what's happening and what the trends are there, and trying to adjust here.
Yeah, Ravi, with traveling into certain countries prior to COVID-19, where there was certain vaccinations that were required to visit those countries, you had to demonstrate that you had that vaccination and have that with your passport. So with COVID-19, why couldn't we do the same thing?
Can you ask that question again, Gary?
Yeah, so this, I guess, is around the whole topic about having vaccination passports to allow us to identify those who have been vaccinated who want to travel and have more freedom because they have been vaccinated, fully vaccinated for COVID-19, and having a passport of some sort to enable that.
Yeah. Well, again, this is, I was speculating in my answer previously, and
Yeah.
I was told a long time ago when I got into the politics business, never speculate. And so I was doing that anyways and breaking the rules. And again, this is a decision the federal government's going to have to make. They have the responsibility around it. I suspect that having the way our system is built here in British Columbia and in many of the provinces is built in a way that if a person wanted to get access to their vaccination record, they could go online and get it. So we've built our system that way, that people can have access to their own vaccination records for the purpose of traveling. I think the challenge we're having is, certainly in the US, they don't have a uniform system. It's the one benefit of a public healthcare system, that we have a centralized data collection that we can, streamline how we can ensure that people can have their records, but do it in a way where their identities are protected and their information is protected. The US doesn't have a streamlined system. Washington State had to declare a federal state of emergency, or a state of emergency, in order to get their some of their institutions to even share information with them. And so I think they're going to have more challenges on their end. But again, I think Minister Qualtrough might be better positioned to answer some of those questions, where the federal.
Wonderful. And talking about the feds, one of the I guess the question was asked previously about border crossings, and particularly with the U.S. But as you know, Ravi, we have a very unique small community here in Delta, Point Roberts, that we share a peninsula with, that has been devastated by this border closure. And I know that there's been a lot of advocacy from the Point Roberts side as well as the Delta side to get some special dispensation for that particular crossing. Is there anything that the province can do to influence that agenda moving forward?
Yeah, no, I appreciate that question, and it's come to me many times. And even someone suggested that I don't know how the BC was stopping that. BC was stopping that to happen, and that's just ridiculous, because all border decisions are from the federal government.
Right.
We have. I wish they would listen. The federal government would listen more to us, but they have that jurisdiction, and they have the ability to make that decision. And I would encourage you to raise it with Minister Qualtrough and our colleagues. And it is a very unique situation. We look at communities along the Alaska border, and because of the shopping nature of the communities going back and forth, they've been trying to figure out the same kind of solution for themselves up there, because their communities are so dependent on each other. So it's very similar to the situation in Delta. Yeah.
Okay. Well, Ravi, we're coming up to the 45-minute mark, and I know that you have a very busy schedule, and you need to move on to your next meeting. I wanted to thank you so much for taking this time to share the plan with us. We're just all so relieved and delighted that we're moving forward. And thank you for all of your work and your advocacy on behalf of Delta and Delta businesses to get us to where we are today.
Yeah, thank you, Gary. And I hope everyone stays safe, and please encourage everyone to get vaccinated, and look forward to seeing all of you in person very soon, I hope.
Same here.
Yeah, okay. Stay safe.
All right, Ravi. Thank you so much.
Bye, everyone. Bye-bye. Bye-bye.